Hey, it's Kayla, respiratory therapist. Let's talk about OSA, obstructive sleep apnea, versus CSA, central sleep apnea. OSA is the most common type of sleep apnea diagnosis. An obstruction is defined when there is a closure or collapse of the airway. But it goes even further. We look at the percentage of closure that's occurring. When there's a partial closure, that's called a hypopnea. A hypopnea is defined when there is a closure or airflow reduction that's happening between 30 to 50%. When you have airflow reduction or a closure that's happening between 50 to 100%, that is called an obstruction. Then we have to talk about the apnea component. An apnea is defined when there is a pause in breath or a reduction in airflow for 10 or more seconds. When you have a sleep study, you have something called your AHI, or your apnea-hypopnea index. Your apnea-hypopnea index is an average of the apneas, obstructions, and hypopneas that are happening on an hourly basis. It's basically just an average overall that determines how many events per hour are occurring. It's normal for us to have events anywhere from 0 to 5 per hour. When you start to get more than 5 events per hour, that's when we get into the diagnosis realm. A mild diagnosis is going to be events that occur anywhere between 5 to 15 times per hour. A moderate diagnosis is going to be events that occur anywhere between 5 to 15 times per hour, and a severe diagnosis is going to be when there's 30 or more events that occur per hour. Hopefully that helps you to understand obstructive sleep apnea. Now, let's move into central sleep apnea. A central sleep apnea is a little bit different. It's a misfire in the brainstem. The brain just doesn't signal for us to take a breath while we're sleeping. This might help you to understand why some people have a neurologist that takes care of their PAP therapy versus others who have OSA and they have a sleep doc or pulmonologist.